Okay, before I
Yes,
continue.
we can see.
Okay,
Yes.
brilliant. So, thank you to you for the kind introduction and to UCARE for you for the invitation to speak today and share my own experience as a patient. As Professor Emek mentioned, I also work in healthcare research, and I will share a bit more about that as we go. Just to give you a quick overview before I get into some of the detail about my own personal experience. I have been a chronic spontaneous urticaria patient now for 2 years, 3 months, 1 week, and 2 days. I had my first urticaria outbreak in July 2022, following my third COVID infection. I pretty much self-diagnosed before I could get an appointment with my doctor, given how long you have to wait to get appointments with doctors. And I had to be very self-directive with my doctor at each stage of my care to self-advocate. I experienced 9 months of severe daily full-body outbreaks of urticaria, with hundreds of patches all over my body, variably controlled with 3 to 4 antihistamine drugs and a cocktail of other drugs as well. I waited 9 months to see a specialist in the NHS, so I'm based in the UK. It took me 9 months to see a consultant dermatologist, at which point I was prescribed omalizumab. I now take monthly jabs, and I've experienced better controlled management of my condition since May 2023, so that's just over a year and a few months. And I've had occasional outbreaks during the breaks in between my medication. I really struggled through my journey as a patient with the mental and emotional burden that, you know, that just was a huge part of my experience. But I took an approach of proactively learning about my condition through reading and meeting experts to cope with some of the uncertainties that came with me being a patient. And as Professor Emek mentioned at the start, this is a very emotional topic. So when I was preparing for this presentation, I thought, how can I deliver this in a way that means I can also manage to get through this presentation? And what I've done is, over the next few slides, I've put together a diary of excerpts that capture different stages of my journey. So what I'm actually going to do, rather than presenting it, I'm going to read out my experience. Sorry, if you just give me a second. I might have to reshare because I can't see my notes in this version. So if you just give me 1 second. Okay, brilliant. So moving on to the next slide. 6th of August, 2022. It is now 3 weeks since my first urticaria patches appeared. My arms and legs are covered in hundreds of raised, swollen, itchy patches. I'm not sleeping much at night, and I'm waking up feeling irritable and exhausted. I diagnosed myself within a week of the outbreak by reading about urticaria on the internet, as I had to wait for my doctor's appointment. This week, I met with my doctor for the first time, who said, "It's just a skin condition. Seems random, no idea why it happens, but it should go away in a couple of weeks. So don't worry, don't think about it too much, because that might make it worse." I've been advised to take antihistamines, which I've already been doing for a couple of weeks, but I'm seeing very little difference. The patches come and go, appearing on different parts of my skin. I've started a photo diary, so my day begins with inspecting my body and taking pictures to keep a record when I wake up. I'm feeling very self-conscious and starting to feel embarrassed about going out. 17th of August. Don't have a slide for this one. The antihistamines weren't making any difference, so the doctor prescribed me a 5-day course of steroids. The steroids worked like magic. Within a few hours of taking them, my skin was completely clear. Relief at last. I have just had 5 days of feeling normal again, sleeping at night, being able to go out during the day. I finished the steroids today, and I'm wondering how my skin will be tomorrow. 18th of August, 2022. I've woken up to a nightmare. I had a cry. My skin looks horrific. I can barely see any skin which isn't covered in hives. Arms, legs, face, neck, back, stomach. All covered in ugly patches of red. Weird shapes, all swollen. I can barely see any skin without patches on it. My skin is burning. Why is this still happening? No one can tell me when this will go away. I don't recognize myself. Back on a call to my doctor, who has prescribed more steroids and can't tell me much else. I ask my doctor to refer me to a specialist. She responds, "We're already exploring all the dermatologist recommended treatments. What more do you think a specialist will tell you?" I'm wondering why I'm having to explain to my doctor about the need to see a specialist in urticaria. I've been reading papers on urticaria, though I'm not a medic or a scientist, and I mentioned to her that there are other treatments which only specialists can administer, though I don't understand the details. I'm feeling very frustrated and helpless at this point. And I've shared a picture here of what my skin was like on the 18th of August. 23rd of August, 2022. My steroids have finished again, though the patches broke through the steroids this time round. I've woken up with an itch in my brain, another full body outbreak. I'm feeling dread for the day ahead. I don't want to see anyone. I've cancelled all my meetings and socials for the week ahead. I look and feel awful. I want to be on my own. I call my doctor again after sending her more photos of my skin. She asks, "What do you think we should be doing?" I mention some blood tests that I have read about in the papers, and she tells me she will order them. Again, I don't know what these blood tests are, but I'm trying everything that I can. I get a call from the hospital the same day. This is after my doctor has referred me over to a specialist. They have scheduled my consultant appointment with a dermatologist for July 2023. That is 11 months away. I'm shocked and in disbelief. I couldn't help but cry on the call when I was given the date. I have had almost 6 weeks of this hell. How will I survive another 11 months? I'm feeling angry, but also completely hopeless now. October 2022. It has been 3 months now of daily outbreaks. I'm on a cocktail of drugs. I'm taking around 16 to 20 pills a day: cetirizine, fexofenadine, montelukast, famotidine, loratadine. I have to go into the pharmacy every couple of weeks to collect my drugs. Sometimes the surgery pharmacist changes my prescription without telling me. I turn up to get my drugs, but only come home with half, again in tears, knowing that I won't even have the drugs that I need to partially manage my awful days. I'm a foodie, or was a foodie. I've completely changed my diet to a low histamine diet to limit how much histamine is in my system. I know that the food is not the cause of my urticaria, it's autoimmune, but reducing the amount of histamine in my body helps. It helps reduce the severity of the outbreaks. So that means no seafood, no tomatoes, aubergines, citrus fruits, spinach, lentils, spices, the list goes on. Potatoes, butternut squash, and carrots are pretty safe and what I've been living on. It makes going out to eat impossible. What do I answer when the waiter asks, "Do you have any allergies?" Histamine allergy hasn't made it onto the list yet. I love traveling, but have never felt more afraid to go anywhere away from home. I've started a new job this month. It was my first day at work, and I went in covered in hives. This is my life now. I wake up in a state of trepidation and uncertainty. I haven't felt the joy of the everyday in a while. It feels lost. Things I once loved now feel like a burden. Will I be myself again? December 2022. I wake up each day and Google search urticaria, COVID-19, hives, to see whether anyone else is experiencing what I am. I've been stalking the global experts in urticaria online. I found a tweet by Professor Marcus Mora on Twitter. He mentioned the Global Urticaria Forum happening in 2 days in Berlin. I emailed the organizers on a Sunday night and I asked if I can come along to learn more about my condition as a patient. They reply the next day and say yes, they waived the registration fee for me. I feel hope. I might find some answers. It's the 8th of December and it's my birthday. I'm spending it at the Global Urticaria Forum, learning about my condition. And learning about what's going on inside my body. I meet a doctor who works at the John Radcliffe Hospital in Oxford, where I have my referral for next year. And I talked to him hypothetically, what would you say to a patient who had X presentation and they're being managed in this way? He said they would need to be prescribed omalizumab. I felt a roller coaster of emotions at the conference, reassured that such incredible minds are working to find answers for my condition. Yet also fear that so little is actually known. I was overwhelmed that this is a systemic condition that is probably affecting so many other parts of my body. I felt hope that there may still be a treatment for me in a drug that I have not tried. My day job is in the ethics of healthcare research. The importance of healthcare research and the hope that patients place in it has taken on a new meaning for me. I return home filled with more knowledge, but with a heavy heart that very little will change for me anytime soon. April 2023. 9 hard months have passed. It is Eid day. I am not with my family, as it is finally time for my hospital appointment with the consultant. I am expecting I'll get the omalizumab shot today. The doctor walks in, he introduces himself and asks me to show him my skin. So I open my gown, he takes a look, and then he asks a few questions about how the hives change day to day. By now I've learned all the lingo. I tell him I've kept a photo diary to show him how things have changed each day over the last year. He asks me to show my pickies, so I take out my phone. He looks at it and decides that I'm ready for treatment. But I still have questions, so I remind him. We met at the Global Urticaria Forum in December last year and we spoke. He double takes and is now all the more attentive. The consultation ends within a few hours. I'm all jabbed up with my omalizumab shots, feeling hope and fear. Will it work? Will it not? It has been over a year now, and I'm still continuing my monthly treatment. My urticaria is much better managed, but I still have dreams about having outbreaks. I wake up, I look at my skin, and I breathe a sigh of relief that my legs and my arms are clear. Going down memory lane for this presentation has made me feel very itchy and brought the emotions flooding back. My quality of life is better, but it doesn't feel over yet. My legs are still experience swelling. I still worry about the day that my drugs might stop working. Sometimes I get minor flare-ups. I worry about the increased risk factors I now have for other conditions. And I know that the psychological and emotional impact of this condition, though better managed, continues. Thank you very much.
Arzoo, thank you so much. That was a wonderful presentation, and really, I also had some tears in my eyes while I was listening to it. I think it's wonderful. It's amazing. And thanks for doing this for us and also for all the urticaria patients out there, so that people can understand how they are struggling with their life. It's so difficult, really. And also you mentioned Marcus, and we are totally missing him. And he formed a bridge between the patients, support groups, and also with physicians and with companies. So the progress we are making today in urticaria field is mainly due to his effort. So we really miss him. And thank you so much. maybe afterwards we will discuss about what you have been gone through. But now I think we need to move forward with Anna's presentation. So she will be talking about which are the most common psychiatric conditions associated with chronic urticaria and how to find out these comorbidities and also how to evaluate our patients with respect to psychiatric comorbidities.